So my name is Jayne Keller, and I'm the Executive Director at Holly Creek Retirement Community, which is part of Christian Living Communities in Denver, Colorado. And I have a long history, about 30 years of working with older adults. I started as a nursing assistant in the 80s, and that was an eye-opening experience. That was my first time working with older adults, but I loved it. And continued to work with them through college, through my undergraduate degree, which I received in music therapy. And then when I moved to Denver, Colorado, I knew that working with older adults was a passion of mine. It was comfortable to me. I found it rewarding. So I continued my career and worked in a number of different positions in area nursing homes, in activities, in working with those living with dementia, working in admissions and administration, and received my administrator's license, nursing home administration license, in the late 90s, and worked as the executive director of a nursing home for many years, and went back to school to get my master's in health services administration at Regis, and then eventually started to work with assisted living and independent living, and really loved working with older adults in that area of living as well. And so then eventually came to Holly Creek, where we're mostly independent living residents. We do also have residents living in assisted living and skilled nursing and memory support.
Can you talk about some of the barriers in aging services, providing care to older adults, and just across the continuum of care?
I would say our greatest barrier is the perception of aging. Ageism, as many people would call it, the perception of aging, where people are doing everything they can to not become old, and our culture of viewing older adults as frail and not able to contribute. So that's the perception that we're battling in this profession of caring for older adults or providing services for older adults. So that barrier is prevalent in recruitment for team members to come on board, finding the right people that want to work with older adults. That barrier is also present in people who are living at home, need more assistance, but they're saying, no, I'm not ready. I'm not ready to move into a retirement community or a nursing home. And so people with a perception of nursing home in their minds, they're seeing what's on the media, which is not always positive, and they have a perception of the nursing homes that we saw in the 70s and the 80s, and we've really come a long way in providing person-centered services to those needing our help. Our culture, our society has not embraced the older adult like many other societies do, and so that is a big barrier for us as well in terms of recruiting qualified people to join our industry. It's very, very difficult to find people who want to work with older adults, and there's so many things. I mean, the list is huge of different things that we can do in serving older adults, but it's getting past that perception of aging, that people don't understand what older adults can bring to our communities.
What are some of the solutions? What are some of the opportunities?
So solutions, I mean, it's a big bite to chew in terms of trying to change the perception of aging. As an individual, I try to tell everybody everything I know about aging and how cool it is to age in a community, in a retirement community or in a nursing home, and all of the things that are available. I myself work very hard at trying to help others understand through social media and through conversations. As an organization, we try to do a lot of education around ageism. What is it and why is it not okay? And trying to educate people about aging successfully and what you need to do to age successfully and to live long and die short. So we're, as an organization, working very hard on all the education and trying to help people understand what older adults can bring to our society and how much they can continue to give and continue to grow.
Can you talk a little bit about professional opportunities in this area of practice, possibly even giving some advice for new professionals?
Sure. I mentioned earlier the list is long of the different things that you can do in working with older adults, whether it be a community-based job or serving people in the community while they're in their own homes. There's a lot to do. Someone might think it's just providing direct care or caregiving or home services, but there's so much more to it. One area is in enriching their lives, in providing avenues or opportunities for people to continue to thrive and to grow through activity programming, experiences, excursions. There's a lot of different things you can do in working with older adults around activities and life enrichment. Dining services, culinary, there's a lot of opportunities to grow. Our organization here at Holly Creek, we have 7 dining areas and 3 restaurants and a huge menu of options where our cooks and chefs can really practice their culinary skills and really raise the bar in terms of fine dining. So there's a lot of opportunities there. There's opportunities in finance and accounting, of course, and of course in administration, such as myself. I started as a nursing home administrator. I continue to work closely with nursing home administration, but now I'm an executive director of a campus. There's also nursing opportunities. We employ registered nurses, licensed practical nurses, qualified medication administration professionals, certified nursing assistants. We have other departments, of course, building operations and housekeeping. I could keep going on and on and on, but there's a lot of different opportunities to serve older adults. There's really, some people may think it's just nursing, but it's much, much more than that. Much, much more than that.
And what's your best advice for new professionals who might be thinking about going into this area?
Educate yourself. So if you have the perception of aging, old people cannot contribute or that they cannot grow, you need to educate yourself first and foremost about aging. Aging is cool. I asked, this is straight from the mouth of a millennial this morning, I asked a millennial, what do you think about retirement living? So this individual did an internship in retirement living and it was an eye-opening experience for her. She said, it's like going back to school and living in a dorm. You're surrounded by your friends. You get to eat really cool stuff, not just ramen like it was in school, but you get to eat really cool stuff. You got a happy hour, you get to go on excursions and do really cool things. You have new friends, you have old friends, you're socializing, you're just out and about and around people all the time, just like you were in your college years. And I thought that was an interesting perspective. But educate yourself about what aging is about, and also educate yourself about senior services in serving older adults. If your perception is grandma's nursing home, then your perception, in my opinion, is wrong. And you really need to educate yourself and spend some time working with older adults, volunteering. There's so many different volunteer opportunities to come and learn about what is available in senior services. So educate.